Gaza director at the charity Medical Aid for Palestinians. Good to see you, Fikr. So we have 300 trucks, the Israelis say, will be coming in on each day of those 4 days of those pauses in the fighting. 300 trucks in a territory that usually gets 500 a day. It's something, but clearly not enough.
Yeah, it is something, as you say, but it's far from enough, to be honest. Given that Gaza has been closed since the 7th of October, and even since they started to allow trucks into Gaza, they so far only 1,300 trucks they were allowed, including different commodities, but not even including fuel. All the population in Gaza are in a very dire situation, to be honest, with the lack of water, fuel, food items, hygienic materials, in addition, of course, to the medical supplies, etc. So, I mean, talking about 300 trucks is, again, very, very limited and for what the population are in need in Gaza. However, actually, I really hope, this 4 days of the truce to be developed to a complete ceasefire in order to allow people to breathe and to start to return to their normal life. It's going to take ages, to be honest, I believe, to reconstruct what the Israelis have bombardment over the last 6 weeks in Gaza. I mean, talking about the health system, we're talking about more than 26 hospitals that are out of services. You mentioned in your report, actually, the death of 4 doctors inside the Al-Auda hospital. They were in duty, actually, inside the hospital when they were targeted and killed. And even yesterday, when they were trying to evacuate patients and injuries from the Indonesian hospitals to the south, I mean, when we talk about the term evacuation, we are talking about safe transfer of patients. The way that that was done, actually transferring patients in a bus, most of these patients with different and complex fractures, being transferred in a bus actually to go all this distance to hospitals in the south that is already overwhelmed with the numbers of patients and injuries they have in that area. I mean, the whole situation is inhuman, and the gaps are great, and allowing number of trucks to come into Gaza. This is, again, I mean, it's really far of the expectation and far of the people, what the people are in need in the hospitals and for the whole population in Gaza. Now it's the winter time, actually. The weather is quite cold, and 1.7 million people, they were forced to leave their homes with nothing, actually. And plenty of these patients, these people actually staying in UNRWA shelters with limited access to any blankets or mattresses or food items. But there is hundreds of thousands of people who cannot have access to these shelters, and they are staying in the streets without any blankets or mattresses, anything. So, I mean, the situation is really difficult. I mean, difficult to talk what are the most important needs, because currently everything is needed in Gaza. Everything become scarce. Everything is kind of distracted. And, we need repair for even for the people, for the mental health for the whole population in Gaza. We're talking about, the children who lost families, and the mothers who lost their kids, and we've been talking about the WHO stuff. There is plenty of these people who were just taking shelters in different places, and they basically were targeted and killed, and unfortunately, thousands of these are still under rubble, and even the civil defense, because of the limited capacity and the limited fuel, they cannot even reach to these people and save them.
Fikr, thank you very much indeed. We're going to have to leave it there, but obviously the humanitarian challenge for 2.3 million Gazans will continue for a long time. Fikr Shalltoot in Cairo, thank you.